If you have foot pain, heaviness, or you just want to give yourself a nice massage, you're in the right place because I'm going to teach you the best techniques so you can give yourself a great self-massage. You'll only need a stool to sit on, some cream, and of course, a lot of enthusiasm. The first technique is an effleurage or a superficial stroke. The goal of this technique is to stimulate all the superficial circulation at the level of the foot and start to stimulate the nerve endings. In the same way, they are very superficial if they are at the level of the skin. For this, it's very simple. Just place your hands around that foot as if it were a sandwich, one on top and one on the bottom, relaxed without pressure. We are going to go over the entire surface of that foot until we reach the middle part of the leg. We take our hands, place them on the foot. We don't apply any pressure. It's just a rub, a superficial touch up to the middle part of the leg, a light superficial drainage. We are targeting the circulation that is located in the skin, the nerve endings that are in the skin. As I said before, we can use a little bit of cream, a little bit of oil, whatever you need to reduce that friction and make the massage much more pleasant. Let's do a couple more. Very good. Last repetition. We can do 10 passes for each of the techniques, but feel free to do as many as you want. And next, we go to the foot. Like a sandwich again, thumbs underneath, long fingers on top. And what I want you to do is to press down on that foot. Press and move, press and move, press and move, press and move. And we move again towards the ankle area and ultimately towards the calf area. The goal of this is to target more of the deep circulation, veins, arteries that are in a deeper area between the muscles, and we want to squeeze to start emptying them. Keep in mind that the foot is like a sponge. It's a network of veins, and when we put weight on it, for example, when we walk, it helps with the venous return of all the blood that's accumulated in our legs. Again, we squeeze, 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 squeeze. We empty that foot of blood, squeeze, squeeze, squeeze. How many times? 5, 10? There really isn't a set number. Just feel free to choose as many repetitions as you want until you feel your foot is more relaxed, more emptied out. And don't hold back on using force. Here we really want to squeeze that foot to get all that blood out and send it up to the calf. Once we've done 5 or 10 squeezes, 5 or 10 passes with our thumbs and our hands like a sandwich, we move on to the actual massage techniques. The first one, we're going to use the knuckles of our left hand if we're massaging the right foot. I want you to locate the heel, but don't rest directly on it. Instead, go a little bit forward. It's exactly here where the plantar fascia begins. I want you to press your knuckles right at the area of the interphalangeal joint, and from here, with a little bit of cream, I want you to apply strong, constant, deep pressure all the way to the base of the toes, right up to here. In fact, basically, it's about working the space that exists between the two pads of our foot. And this way we make sure that we're working that plantar fascia, very thickened, very strong, always very tense, and it helps us maintain the plantar arch and the structure of the foot. When we walk, we press those knuckles firmly. We can hold the foot here with the opposite hand so it doesn't move, and then we bring up to the ball of the toes. We press those knuckles firmly. We slide. If it feels uncomfortable, you can use a little bit of cream. Let's go again. We press, we slide. Very pleasant. All the way to the base of the fingers. Last technique. We press, we slide all the way to the base of the fingers. Although we've done a broader general technique that will treat all of that plantar fascia, we can also do a deeper technique with our thumbs. Simply press right here, just in front of that heel. Pressing with our thumbs at the fascia level. And by doing it this way, we have much more strength, much more depth, and we can go slowly all the way to the base of the toes. It's ideal if you've positioned those knuckles well. You want to give some extra deep work to the plantar fascia and you want to relax it even more. Very, very good. Very, very pleasant. I'm sure you're noticing it too. Watching this video from your home. We press hard, 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 hard and move up to the base of the toes. The goal is to go over the entire plantar fascia. We started at multiple locations and now finish at the most lateral edge. That's it. And what if you notice that any of these passes with your fingers gives you good relief? For example, here where the big toe is, the muscles of the big toe. We can pull and do a couple more passes to give more relaxation to the muscles of the big toe. That plantar fascia is very, very pleasant. Very good. But there is still a deeper technique that I also like a lot, and it's basically stretching the plantar fascia and the muscles of the big toe by bringing this toe toward you in dorsiflexion. We hold it here with our hand. We don't use force with the toe itself. The toe is completely relaxed. And you see how here certain tendons become visible. You can easily feel them with your hand. What we want is to stretch them and at the same time lengthen them, also with the action of our finger. We take our thumb. We start at the base of the heel, as I already showed you, and from here we apply pressure. Now this one is not going to be so strong because you will quickly feel discomfort. It's a much more demanding technique, and we go all the way to the base of the big toe, up to here. Very, very good. Very, very effective. We put on a little bit of cream if that skin feels uncomfortable to you, gets red when doing the technique, or doesn't let you slide well. We can put on a little bit of cream or oil. This way we achieve better sliding and reduce skin irritation. Very, very good. Very slow, very focused, very well done. We push, we push, we push. Very good. Last repetition. Perfect. We push. Very good. And we relax. And just with these 5 or 10 minutes we've spent on the foot, you can already feel the difference, right? More relaxed. Very good techniques. We have gone from the most superficial to the deepest with different possibilities. To finish this fascia massage, I want you to focus now on the heel, using your left thumb. You can also use both if you want to add more intensity and make circles. Here, we're not looking for deep pressure, but rather something more superficial, more about creating movement. It's exactly the spot where our plantar fascia attaches to the heel bone, a very common area of tension for people with plantar fasciitis. So work on it. You don't need to apply a lot of intensity. You can hold your foot with your right hand and work on it with your left. And make circles in one direction, 10 circles, and then in the opposite direction without pressure, just on the surface. We don't have to go very deep with the technique. Very, very good. And what can we do here also? Circular movements with our hand on the inner edge of the foot, also in the area where we often find vascular problems. Small veins, spider veins that we can help to clear using very precise techniques like the following one. Pay close attention, left hand. Remember that I'm massaging the right foot. I support at the level of the Achilles tendon, and from here I move my fingers inward and make a second pass with my thumb. Very good, very pleasant. I'll show you again. With 2 lengths, support at the Achilles tendon level. From here I push inward. It slides along the inside of the plantar arch. And finally, look, the thumb appears. And that thumb also slides along the entire lateral part. If we use some cream, we can go faster and it feels really nice. We slide, we hold the foot with the opposite hand if you want to make it more lively. Thumb, slide, long fingers on the inside. Finally comes the big toe. More like the thumb and inside, one more on the inside. Thumb joins the party, and I go back to the inside and underneath. Aren't you seeing it? But I'm also bringing my fingers back up. I'm not just making this movement, but then I go back up and also massage the opposite side. I insert my fingers with the thumb coming in. Notice the long fingers massaging from the outside and here as well. One more. Very, very good. And to finish that great treatment we've done for the fascia, let's do a stretch. This one is a little more complicated, but I'm sure you'll be able to do it if you take the necessary time. I want you to place your fingers into dorsiflexion towards you. I want you to place those fingers here at the region. Hold the palm of your hand a little lower near the wrist and press your long fingers right here. We do the same with the other hand. I rest my thenar region here, which is this part, the heel of the hand, and I also press my fingers. The goal of this is for you to lean forward to apply force here. Ensure to deeply massage the fascia, noting the pleasant sensation. Spread your fingers wide to fully stretch the fascia. Very good, right here. Don't hold back on the force. Go hard, and I assure you that you're going to feel some incredible sensations. I'm coming back again. I rest the heels of my hands, fingers, heel. I press my fingers in firmly, and then I separate strongly, 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 to produce a great relaxation in the plantar pads. That's nice, isn't it? Let's do 3 more. Support, heels, insert fingers, separate, 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 separate. Very good, impressive. For the last ones, support with the heels of your hands. Insert those fingers well. Very good. Very good. And it stands up to the maximum. Did you see how even the color of my skin, of my fascia, changes? Plantar, that's because we're improving vascularization. We empty the vessels, new blood comes in. Very good. Last repetition. Stretch that fascia to the max, plant it firmly. There, very nice. Perfect foot at the muscular level. It's done. I also enjoy mobilizing the metatarsals. It's a bit more complex, but I'll try to explain it to you. I enjoy grabbing. These long bones that you see here originate from the pinky and ring finger. Middle finger, the index finger, and the thumb. Okay, if you touch the dorsal side, you'll notice how those long bones run from here to the front part of the foot. What we have to do is place a finger at the base of each toe and make a shearing movement, as if we were going back and forth, back and forth, back and forth. A very pleasant mobilization between the metatarsals, especially for those of you who have pain here in this region, metatarsalgia. I place my thumb, I place my index and middle finger on the other side. Notice that I not only have my thumb here, but also my fingers at this point. And look at that shearing movement, how nice it is. The gap between the ring finger and pinky is more noticeable and harder to close compared to the gaps between other fingers. So I'm pushing, you see, I shear, I push from one side and then the other. I push from one side and then the other. I shear, I make this shearing movement between my fingers, middle finger on top, thumb underneath. I do a few mobilizations calmly, we're not in a hurry. Then I switch. If before I was here between the last and second to last finger, now I move up and place myself between the third and fourth. I cut again between the middle and ring finger. This is very good for Morton's neuroma, also very good for those of you who wear high heels often, and you see how I cut that. Those 2 metatarsals move, I mobilize the area, new blood comes in, structures are released, and I work. 1 minute, 2 minutes, as long as you want. We move on to the next level. Look, here I'm holding it between the second and third finger. I'm grabbing here at the base of these fingers. These move less. We already tried to get that nice shearing at the beginning. Pay close attention, just like on the other side. I've also placed my long fingers to give it support and make that shearing movement that's giving you trouble. Don't worry, it's just a matter of practice. Let's continue for a minute. Let's do 10 to 20. Shears, and then we move on to the next one. Finger at the base of the big toe, finger at the base of the index finger, the second finger. I've named them so you can guide it. Now observe the shearing that emerges here, right? I already mentioned there would be less movement, but there's still a lot here, right? Look closely. How is that thumb moving, that big finger, and that first finger? Very good sensations. This would be the last mobilization. We've finished at the foot level, but we haven't finished the massage, okay? We'll go up a bit more to release the malleolus and Achilles tendon, which is also crucial to treat. Finally, let's work on our calf muscle. Since we've brought blood to the calf, it would be a shame for it to remain there. Let's try to move it a little higher, so that later, when you stand up, That muscle contraction improves all that circulation and drainage in your legs. Very good. Very simple, okay? I want us to make circles around the malleoli. The malleolus is this bony structure that sticks out in all of us, which we usually call the ankle. I want you to place your hand with the 4 long fingers underneath and make circles, just like we did before, but under the heel. Now we keep making circles around the malleolus, a simple superficial effleurage, just like at the beginning. What we're mainly looking for is to stimulate superficial circulation, to stimulate the nerve endings in the skin to help relieve pain. We can do 5 inward and then 5 outward, 5 regular circles. I use both hands. The bottom one is going to make circles underneath, the top one makes circles above. Very simple, and we do it in unison, okay? It's not hard to coordinate. Circles down, circles up, a little bit of cream if there's some friction, circles down, circles up, and if you want to add a little pressure, you can do that too, okay? It's very nice when you do it on both sides, and like I said, we do 5 on each side, okay? In and out, I just switched. Very good, very nice. The ankle always feels really good during a massage, honestly. A couple more circles, more circles, more circles. And now we move on to the Achilles tendon, this area here, this hard tendon that connects our calf muscle to our foot. All I want you to do is place your hands, your fingers, as if they were a clamp. Let me see if I can show you. Thumb on top, index finger on the bottom, thumb on top, index finger on the bottom, and do it with both hands at the same time. I want you to grab very close to the bone. In fact, right here, you're going to be right on the tendon. We go down a little, and the bone is like a small bump. We stay there, and I want you to press a little with those 2 fingers and do a mobilization. An upward glide doesn't have to be very long. It should be short. In fact, the tendon doesn't have much section. We press on that base and gently pull those fingers upward with some pressure. It seems like there's little movement, but look, I start here and I'm here, moving my leg outward, pressing at the base level with both fingers. It's pleasant, slightly uncomfortable, but also very good. And I move that tendon upward. If I pull a little on the hair in this area, which is happening to me, I apply a little bit of cream. We squeeze with the tweezers and go up, 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 up to relax everything. That Achilles tendon is the strongest tendon in the body. It often gets injured in weekend athletes, so be careful if you go out to play paddle tennis this weekend, because it could cost you dearly. I dig in my fingers, I bring them up, and I relax. I dig in my fingers, bring them up, and relax. 10 times would be ideal. We dig in. And we move. Last repetition, we dig in and up, perfect. And we only have one last technique left, which is the flugas from the calf area. Very simple. I'm going to bring my foot more to the inside. Notice that now I'm resting my malleolus on the knee. Before, we had one leg more crossed, the foot was free. Now we bring it more outward. It's the malleolus that rests inside the knee. And what I do is bring it back, really return to the position where it was, this one I was doing. So I start here with what my hands like this, okay, and what I'm going to do is this. I open and close his thumb constantly from here. And I work all that muscle at the calf level, very good, very pleasant, to drain it, to work it, to stimulate it. I take my index and middle fingers, apply pressure, and make a pinch. Pinch and relax, 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 pinch and relax. Very pleasant. Let's do 2 more. Pinch and relax, pinch and relax, pinch. Pinch, pinch, last repetition. Pinch, 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 and relax. Very good, that's all I had prepared for you today. And I'm sure your foot is extremely grateful for the time and massage you've given it. I hope you can share it with people who need it too. It's good for everyone. 10 to 15 minutes of relaxation and a good foot massage. If you want to receive all the videos I post on my YouTube channel every week completely free, you just have to click up there in the top right corner. Leave your email and you'll join my newsletter. Every week, on Sundays, you'll receive an email with my content and all the news or program launches I do throughout the year. Thank you sincerely from the bottom of my heart for watching until the end of the video. I hope you repeat this massage frequently, 2 or 3 times a week, and of course, I hope to see you again very, very soon in one of my other videos. Bye, friends.